Hello, my fellow respiratory therapists. This afternoon we'll be discussing a topic that affects everyone, gender-based medicine. Let's start off by determining the differences between sex and gender. Sex refers to the hormonal and anatomical differences between males and females, with an emphasis on the reproductive traits. A woman has two X chromosomes, as we can see in this diagram, while males have an X and Y chromosome. We can see some of the differences here. And when we talk about gender, this refers to the role of males and females as defined by the culture. Gender refers to an individual's concept of themselves, which could also be referred as gender identity. Gender includes all the norms that society sets in order to differentiate between males and females, such as some things that come up to mind are females are expected to raise children, to wear heels, to wear makeup, while men are expected to work, to like sports, and to be masculine. Since there are biological differences between males and females, a different medical approach is required. For example, women typically have smaller lungs, therefore they have smaller lung volumes compared to males, so this must be taken into account when providing mechanical ventilation. If you provide the same lung volumes for males and females, it is really likely that on the female, lung is going to get ruptured. So, in addition, there's certain respiratory diseases that primarily affect women, such as pulmonary hypertension, pregnancy-associated asthma, bloody pleural effusions during menstrual cycles. So all of this needs to be analyzed when treating patients. It's also important that medications are targeted to the patient's sex. As females process medication differently from males, a lot of times females, it takes a longer time to process the medication. It can be said that the development and progression of certain common respiratory diseases have been found to be differ by sex. For example, on the non-smoker population, women are 1.5 times more likely to be diagnosed with COPD when compared to men. Another example would be coronary artery disease. The anatomy of the heart on the females is going to be smaller, which is going to affect how the disease process happens. The symptoms are also different for a lot of the heart problems from what a female and a male experience. So these are just some of the examples of how diseases differ depending on the sex, but there's many more. Now let's talk about how when the sex differs from the gender. I encounter a situation where a transgender female, so she would have an XY chromosome, but would look like a female. So she came into the hospital with chest pain. Many things needed to be considered, such as the risk for a heart attack, if the patient was taking hormone therapy, was it stress related? Did the patient get breast implants? Can that be the cause of the pain? So many things needed to be analyzed before treating, as modifications in the body can impact diagnosis and treatment plan, as healthcare providers might think, a healthcare provider might think he's treating a female and not account that the patient was born a male. So even though the person might look like a female, the risk factors for diseases might be of a male. The fact that the transgender female was born a male, so the XY chromosome, makes her more prone to certain diseases, and treatment plans would be different from a born female. Males tend to have heart attacks at a younger age and are twice as likely to have a heart attack in comparison to females. So all this information needed to be accounted for when treating this transgender female. This situation might be tricky for the healthcare workers, as you might see a female and you want to medically treat her as one, but then you need to account for the fact that she was born a male, because it does make a difference of how we provide care. The treatment options and risk factors, all of that. The lack of gender-based prevention holds back more efficient healthcare. Gender-based prevention and therapies are more effective than the usual one-size-fits-all approach. We don't give the same medication for children to adults, so why should we give the same medication to males and females? So, as mentioned before, medications are processed at different rates depending on the sex, so this must be evaluated prior to giving the medication. Sex and gender differences affect health outcomes and must be accounted for when treating patients. Even though gender-based medicine is still something new, it should expand because the benefits are going to be amazing. Even if a male and a female have the same illness, sex must be considered when treating the illness because it's going to differ. If sex and gender is not evaluated, then proper diagnosis and preventative measures will be inadequate. It won't be right. Based on your gender, you're more prone to certain diseases, meaning that different preventative measures will be required to prevent that. All of this must be considered when providing healthcare to patients. Since gender-based medicine is still something new, all healthcare providers must be educated on the subject. There should be more studies that analyze treatment options on both females and males, because currently most studies have more male participants, so the results are going to vary. Each healthcare department needs to study the differences between males and females when providing care. Specialized care based on the sex is something that will improve healthcare. Customizing the strength of medications is something that must be done and will have positive effects. It's extremely important to provide healthcare that's specific to an individual. Hopefully in the future of medicine, there'll be more approaches based on gender-based medicine. We need to be part of this movement because the outcomes are going to be outstanding. They're going to be more positive. Patients are going to get better sooner with less side effects. So it's going to be great. Okay, thank you for your time.